Okay, well, first of all, it's my pleasure to introduce today's rounds, and the speakers. The rounds will be given by four very talented master's students, Fabricio, Batistella, Zasso, Atina, Boonchit, Angie, Puerto, Nino, and Sabrin, Salim, all of whom are registered in the Translational Research program at the University of Toronto, which is directed by Joseph Fehrenbach. And I just want to say a few words about the research program before I turn it over to Fabricio, who will start the presentation. So the TRP, or Translational Research Program, was initiated in 2011 and approved by the Ministry of Colleges and Universities in Ontario in 2014. And it's been led by Joseph since its inception. And the mission is actually quite exciting. It's to provide transformative and educational opportunity for innovation and to catalyze transformation of scientific discoveries. And the MOT has always, since its inception, we've been a partner, and I've been asked to serve on the advisory committee for several years. So as part of the program, the students complete a capstone project, and you're going to hear about this today from these four very talented students. And it's entitled Understanding the Effects of the Recent COVID-19 Pandemic on Solid Organ Transplantation, which is certainly pertinent in this day and age. So I'm going to turn it over now to Dr. Fabricio Zasso, and he will start the presentation for you.
Hello, so good morning to all. So like Dr. Levy said, my name is Fabricio, and first of all, I would like to thank you for the opportunity to present our project here at the MOTP Grand Hunt. As Dr. Levy so well introduced us, we are a group of 4 students from Translational Research Project. And this is part of our second year project, so we need to finish that to complete our master's program. This is a project that we started to contextualize in April of 2020. So it was at the beginning of the pandemic, first wave, everything was on lockdown. And so actually we are really happy to choose this topic, I believe. At the time, no one knew for how long it would be here. And we're still going to, maybe for the last part of the project, the pandemic is still in here. So next slide, please. So first, we would like to acknowledge our advisory teams, both from UHN and from the TRP program. These persons have given a really valuable contribution to our project, and without them, we will not get next slide, please. So for the session today, our learning objectives would be understand the complexity of the organ transplantation system at the MOTP, visualize the impacts of COVID-19 on healthcare delivery at the MOTP, and recognize the value of qualitative approach to understanding stakeholders' perspectives on organ transplantation. Next slide, please. So this is our agenda. We are going to go through the background of the project, the research question, the expected results, plans going forward, and we're going to finalize with discussion. Next slide, please. So in the next 3 slides, I'm going to show, and we are all aware of that, how the healthcare system in Ontario has been under tremendous strain over the last years. In this slide, we can see that in the last 20 years, our population increased by 40%, Ontario population. At the same time, our non-acute and acute beds capacity reduced also in 40%. So the system has been put against the wall more and more over time. Next slide, please. So this slide, it shows how much provincial governments are spending, mainly in the 4 major provinces jurisdiction in Canada, per capita in the period of 2005 to 2017. And we can see that consistently, Ontario is the province that's spending less per capita. And if compare with Alberta, that's the one that's spending more, we are spending 30% less. Next slide, please. This is another interesting slide comparing in the light blue columns, you can see all the provinces and says the number of acute care beds per 1,000 people. So the purple one is Ontario. So you can see that comparing to the other provinces in the country, Ontario has the smaller number, 1.4. Of all, Canada is in yellow, 2.0. And if you compare also with all the other developed countries, Ontario also has a smaller number. So we're really behind on this number. So with this, all that comes for us to conclude that we have very limited, sorry, next slide, before that. Yeah, so that brings us for a question. Does Ontario have the medical capacity for a global pandemic? So we know that despite this increase that I showed of 40% in population in the last 2 decades, only one hospital, new hospital was built with 185 bed capacity, and this was like 1 or 2 months ago. We know that the incidence of cancer, heart failure, diabetes, and obesity are consistently increasing. The hospitals in general are running with almost at the limit of their capacities. Waiting times for being admitted, patients being admitted at the emergency department are always like increasing. And of course, the amount of population over 65 years is rising over time. So with that, we conclude that there is very limited space to manage a pandemic such COVID-19 that just reached us. And now I'm going, my colleague Sabrin is going to continue the presentation. Next slide, please.
Thank you, Fabricio. So to talk a little bit to the impact of COVID-19 specifically on transplantation, and now looking at the specific impact on this medical service, we're seeing that the impact exists, I guess, at different levels. In practice, we're seeing it on policy levels, and we're also seeing it at systemic levels. So specifically, I guess when we're looking at some of the literature, as well as some of the experiences that people have really shared, we're seeing 3 major areas that we'd like to highlight here. So the first is the impact of clinical activity, which I'm sure you've all experienced to some regards. So we've seen an impact of COVID on workup. We've seen it on the ability to conduct or perform transplantations, whether within the medical space or within a resource kind of avenue. The other thing that we're seeing is that post-transplant care and clinical activity as a whole has really started to look a lot differently with COVID. So this is one of the things that we're keeping in mind when we're looking at the impact of the pandemic. The other thing that we're looking at is education and what education looks like. So for example, our rounds here today are virtual. So that's one thing that's changed. We're seeing that patient education as well as outreach education also looks really different, I think, in the midst of the pandemic. And the last aspect that we'd like to talk upon is research activity. So to a certain extent, clinical trials, of course, have looked different. We know that recruitment for certain studies has also changed a lot. So these are all kind of like a broad view, I think I would say, of the impact of COVID specifically on transplantation. So when we look at specific numbers, so these are actually the national numbers of transplantation, and we can see a very stark contrast and a stark reduction between 2019 and the numbers here, as well as 2020, which we would declare as the start of the pandemic. So we see across all organ groups within Canada, there is a notable reduction in transplantation, starting at 10% going all the way up to about 35% reduction over the years. So we're seeing both a qualitative impact in terms of our ability to function and to perform certain activities, but we're also seeing a quantitative impact in terms of the volume and the number of transplantations that are actually going on. So now talking to a little bit about why the MOTP and why specifically our project scope is focused here. There's a couple of reasons as to why. The first is that organ transplantation is an essential life-saving service. And I think that it's important to use organ transplantation not only as a model for an essential service that has been impacted by the pandemic, but also to ensure that patients who are receiving organ transplantation are also receiving the necessary care that they require during pandemic. The other thing is that Toronto General has been a global example of healthcare delivery, and which goes into the next point, the MOTP being a world leader in transplantation. So recognizing potential ways in which the MOTP has effectively handled and mitigated aspects of the pandemic, as well as potential areas for augmentation, is important, I guess, as a way to model exemplary care within transplantation when it comes to unprecedented times like this one. And the last aspect is that the MOTP provides a rich context for understanding how contextual pressures change healthcare delivery and what may be done to optimize future preparedness. So as I mentioned, I think that oftentimes the healthcare system is consistently evolving, not only within a medical and clinical setting, but we're also seeing that from a resource and logistical setting, there are always things that are changing. And so it's important for us to learn from the past in order to apply to the future and improve aspects of that. So in terms of recognizing the project, as well as areas that we thought we wanted to understand before going into the project, was we wanted to know what happens at the multi-organ transplant program. And for us to do that, we asked two main questions. So the first is, what processes occurs for organ transplantation to proceed at the multi-organ transplant program? And the second is, what communication occurs between internal and external stakeholders at the MOTP? So these two questions were foundational for us as non-UHN staff, basically to come in and to be able to work and function within this very complex system. We had to have some sort of foundational understanding of what was going on here at the MOTP. So the way for us to do that is a process that we actually developed called organ mapping. So organ mapping is something that we created. It's sort of a reiteration or spin on something we've heard of within service design called journey mapping. And essentially what journey mapping is, and again, what organ mapping has really taken out of that, is looking at institutions and looking at systems and being able to map out and identify specific important touch points across a system. So within organ mapping, this meant recognizing who the key stakeholders are in terms of decision making, how that communication occurs as well as the main points or the main touch points across the organ transplantation pathway. So given that, I will show you a little bit as to what we've done. We're really excited with the work we've done. So this is one component of our organ map. Obviously, you all know this process a lot better than we do, but essentially what we were able to do was through the organ mapping process, which involved being able to pull out information that was publicly available from the MOTP, as well as undergo a process of contextual inquiry. And that just means being able to speak to key stakeholders at the MOTP and really gain some insight into the process here. So those two components really informed our organ map. And really what we identified were three major touch points across the organ transplantation process: at the pre-transplant phase, the transplant phase, and the post-transplant phase. And we were able to map out this process across the living donor system as well as the deceased donor system. One of the things you'll also notice is that we have different colors for different processes. And in the top left corner of your screen, there's a responsibility legend, which essentially just maps out who is responsible for these different processes overall. Of course, this differs from a transplantation to transplant, but this is just generally the process that we mapped out. So as I mentioned, we talked about processes, but one of the other really important things for us to do was to map out the communication network. And the communication network is important not only for us to recognize how information flows at the MOTP, but potentially where the pandemic could have altered or mitigated certain aspects. So again, we have the same phases. We have pre-transplant, we have transplant, and we have post-transplant. And then we centered the patient or the organ recipient as the central point for communication, and everybody across the MOTP as a communication touch point here. So at the top, we have the medical director, the clinical director, the surgical director, as well as other key stakeholders like the multi-organ transplant coordinators, amongst other clinical professionals here. So with that being said, as I had mentioned, one of the other things that we wanted to note was that diagram that we created was a very simplified version of transplantation. And so this diagram, we were hoping at least to shed some light on the complexity of transplantation, as we had begun to realize that, for example, with one deceased donor, you could have multiple recipients. And so it's a lot more complex than we had initially anticipated. And again, this was really important for informing our project as well as informing the information that we wanted to receive. So that being said, I'm going to pass it over to my colleague Atina, who's going to take us into the project aims.
Great, perfect. Thank you, Sabrin. So the ultimate aims of our study are first to define the impact of the COVID-19 pandemic on the MOTP. Secondly, to understand the experiences of healthcare workers, administrative staff, patients and families at the MOTP during the COVID-19 pandemic. And finally, to develop recommendations on how to manage hospital and healthcare resources to improve the ability to deliver essential services during a pandemic. So the research question that's guiding our study is, how can guidance for decision-making of organ transplantation during pandemics be optimized? So the way we've developed our hypothesis comes from looking at healthcare delivery and then considering how can organ transplantation be looked at as an example of a healthcare pathway where performance is affected by systemic strain. So we're thinking that by focusing on how organ transplant has been impacted by COVID, this will give us insight into how the healthcare system on the whole responds to times of systemic stress, how institutional, professional, and individual workflows and experiences are affected, and finally, what can be done to optimize those healthcare pathways. So in terms of our methodology, we'll be using qualitative methods to understand how organ transplant is conducted during non-pandemic times, how it's changed during the COVID-19 pandemic, and most importantly, what the thoughts, experiences, and feelings are of those who are directly involved in transplant are. So the first stage of the process that you've already seen is the organ map. So this has helped us to see at a glance where certain processes happen and who's involved, which also informs our own understanding for the next phase of the study, which are semi-structured interviews. So in these interviews, our aim is to capture what has changed within organ transplant at the TGH since COVID began, with insights from both the first and second wave so far. We're interested in gauging any and all reflections about these changes, from how workflow has changed to how you might believe things could be done better. Once interviews are completed, our intention is to synthesize those data from the interviews to identify key themes. So those themes will then be used to develop an intervention that perhaps augments the existing strategies at the TGH. So if there's a way for us to help improve or streamline something there in some way, we'll be open to it at that stage. So in terms of our inclusion criteria, we're speaking directly with experts involved in organ transplant. So our 3 cohorts for recruitment are healthcare professionals, administrative staff and external entities, and patients and families or caregivers. So for the healthcare professional and administrative staff cohorts, we're interested in speaking to anyone who's involved in either conducting organ transplant or overseeing transplant here at the MOTP. So in fact, we're still looking to do more interviews, and we believe all of you fulfill the inclusion criteria for at least one of these cohorts. So if this sounds interesting to you and you would like to participate, please reach out to us with your interest at the end of this presentation. We could really benefit from your insight and expertise, and hopefully what we find in this study will benefit the MOTP in return. So with that, I'll turn it over to Angie to talk more about what we'll expect to find in the study.
Thank you, Atina. So now in terms of what kind of results we will expect, we will anticipate that we will learn from TGH protocols for the processes that we are understanding and stakeholder experience, including the 3 cohorts that Atina just explained, to build an existing protocol for organ transplantation during pandemics. And by doing this, we may ensure a rapid patient and stakeholder informed institutional response that actually uses the hospital resources effectively. So in the future, we will be very prepared for pandemics, which all we know will inevitably happen. Next slide. So to achieve those results, we have developed a timeline with our milestone and the deliverables. This is the timeline that you are seeing in this slide. And basically, we have managed to achieve everything on this chart until now, including full REB approval from relevant institutions, UHN, U of T, and Trillium Gift of Life, the organ map that Sabrin previously explained, and half of our semi-structured interviews. And as you can see on the bottom of this chart, our goal is to develop a final report summarizing for our results for both our master program and to present at the MOTP here. And in addition to that, an article for publication. Next slide. So now in terms of our recruitment process, our goal is to interview approximately 21 participants, 5 to 7 participants in each cohort, as you can see on the table. And we have had the opportunity to conduct 10 interviews. We have scheduled 2 more interviews from advanced administrative staff cohort for this week, and we are seeking for 9 more interviews. So again, as Atina mentioned before, for all of you that are interested in sharing all your experiences, please just reach out to us. Our next slide. In terms of plans going forward, we will like to finish our recruitment process, our interviews. In addition to that, and code and analyze all the data through content analysis. We will generate a final report and a paper for submission that will be disseminated to all of you and our additional stakeholders. And in addition to that, we will have our capstone defense that is basically the final presentation for our master program. Next slide. And with this slide, we finish our presentation. We really hope we excited you about our project. for us, all your experiences are very, very valuable. And we believe that our result will benefit not only all of us at the MOTP, but also patient and caregivers and other transplant programs around the globe. So if you are interested in talking to us, please just open your camera on your phone, hover the camera over the left side of the slide. You will find the QR code. This will open up a notification in your phone, and you will be able to send us an email to our study contact Atina, or if you prefer, you can see her information in the bottom of the slide. So you can be in contact with her. Thank you very much again for the opportunity to talk to us, and I will open now the floor for any question that you may want to ask us about the project. If you want to share any perception or experience, we will be open the floor for that. Thank you very much.
Thank you for a very nice presentation. By the way, I tried to do this, and my email did not go through. The message that I got was the server is not working, so you might want to check. I see Atul has his hand raised, so Atul.
Yeah, so first of all, congratulations. Like I'm very pleased that you're doing this. I think it's very important and an excellent project, important not only to our transplant program, but I think that the learnings that you gain from this will be applicable across Canada and internationally, actually. So congratulations. I just had two thoughts while you were giving your presentation. One is that I'm glad you pointed out how complex the whole process is. And I just wanted to highlight that even outside the transplant program, what we found, especially during the pandemic, is we're very interdependent on a number of other specialties and programs. So for example, we were highly dependent on the OR and the OR staff. And when there were illnesses in the OR staff, that affected us. We're highly dependent on ICU capacity. And when the ICU was filled with COVID patients, that was a real bottleneck for us. We're dependent on dialysis. So, you know, as COVID patients often do end up needing dialysis, there was a shortage of dialysis spots available. And there was also a lot of healthcare worker absenteeism in the dialysis program that affected us. So there's a whole number of these sort of interdependencies that we don't always think about, but were highlighted during the pandemic. And then the other thing I'll just highlight for you is the mental health impact on our staff, actually, which has been huge during COVID. It's, I think, been a very stressful time and impacted the way we deliver care for sure. And Susan Habbey's been very helpful, and her team have been very helpful to us. And I think you may just want to consider that as part of your project. So.
Thank you very much. Yeah, absolutely. We have actually discovered through the first batch of our interview that these two main themes about resource availability and mental health are issues that our transplant team is confronting right now. And we are getting very valuable insights in those two topics.
Maybe Shahid, I don't know if you can hear me. So first of all, I think the students did a great job. It's interesting if you do a PubMed review, and I sent some of the students some of the articles. There are many articles showing, as Atul alluded to, the impact that COVID has had on delivery of services. For instance, many of you are probably aware in BC, suicides are up 500% due to fentanyl overdoses. If you take a look at cancer care delivery, I haven't seen a report from Toronto on the internet, but there were reports from European countries, and in particular France and Germany, and then in the United States, where they showed access to care was markedly reduced, and death rates from cancer are up. But I think what's lacking in all of the reports, and I think Atul alluded to this, and why it's very important, and I think it would be essential for members of our program to engage, is why. In other words, there are many roadblocks, as Atul alluded to, and they can be direct roadblocks, which is the institution itself. It can be so lack of access to healthcare services. It can be the patients themselves and the fear, and then just not going forward to seek medical. And so the reasons for the lack of activity are complex, especially within transplant. So I think it's really critical that all members of the program, if they are, this program is so interactive, it would be really helpful if people gave their thoughts as to what are the reasons for the drop off in activity. The other thing is, and maybe it's a question, and I'm not a statistician and I don't do qualitative type research directly. The numbers that you've chosen. So you've chosen a relatively small number. It's 21, if I'm not mistaken, to the students. And maybe you should consider broadening, the input. And then the other, so that's one question. Should you enlarge your cohort, and how difficult would that be to do? And do you have permission, like from the REBs, to broaden it? Because you did put this through the REBs, both at UHN and U of T. And then the second, Atul alluded to it, do you have the ability to reach out to other transplant centers, and especially where there may be expertise which they could help provide to us? And there are some individuals, and I can think of a few, who might give you input, especially with the CDTRP program, which Atul plays a major role in. There are some section leaders which it might be worth considering, but I don't know whether you have the authorization to do that.
These are all very valid points. I see Stefan has raised his hand. So Stefan.
Yeah, thank you. Thank you for the talk. It's I think it's quite interesting and exciting, and hopefully we'll learn a lot. And I actually just wanted to reflect on what Gary said, certainly about 2 points. The second is this reaching out to other programs. Maybe you can enrich that or target that outreach, perhaps, if you look at the statistics of last year compared to the previous one, and identify low perform or programs that where there was a big drop, as opposed to programs that were relatively able to maintain their activities, and try to identify those and reach out to those and repeat the analysis that you're doing. And maybe that could potentially give us a more specific answer of what were the reasons that impacted on activity in general, because at most places there was a drop. But also, if there are differences, what were the factors that enabled certain programs to maintain relatively high level of activity, as opposed to suffering a larger impact. And in terms of the qualitative work, the numbers in qualitative work are usually much lower than in any quantitative analysis. But given the complexity and given the diversity of the players, as you depicted in your organ maps, I think you should probably somehow at least identify groups of people whose perspective may be different, and look for saturation or information power within those groups to target your sample size.
Yeah, absolutely. And one of the ways may be to have focus groups. If there are quite a few people, then you can you have clearly defined 3 groups, And indeed, and the other thing that is missing probably, or you might want to add, is patient groups, right? How have they felt? What is this a hesitation in coming to the hospital because the concept of being not a safe place and others? It's a very complex scenario, as you guys alluded to, and untangling it is really important to for being prepared to next pandemic, which me and Gary was talking before, that it is bound to happen. We don't know when, but it is bound to happen. And in Europe, especially in Italy and others countries where they were very hard hit with COVID, they did not shut down like the way we did here. They cut down the capacity a bit, but they continued the activity. Here during the acute period, we had shut down the activity significantly. While talking to my European colleagues, that was not the case. So this might be out of the scope for this project, but that's another approach that they have taken. A very exciting project, and I'll echo the sentiments of others that it is really going to help us to better prepare ourselves. Understanding the barriers are really important.
Yeah, I would like to jump here. Thank you for the insight. We're approaching to, initially we target for about 20 interviews. We imagine that closing to that, we're going to reach saturation, but yes, I think the organ mapping process shows us how complex the transplantation process is at MOTP. And now that we have like 10 interviews done, we might, I think we should, like you said, we should try to focus in targeting some groups that might be more important to understand the process better. Yeah, I think that's a really important point. Thank you for that.
And just to add to your point, Fabricio, the number that we choose to collect just 21 interviews is not a fixed number. Basically, we will conduct interviews until we reach saturation in all of our main teams. And for those of you that are not familiarized with qualitative methodology, saturation is basically with all the information just keep repeating, and we don't have new insights in the interviews. So we will be open to conduct more interviews if the case is needed. As well as we will take a look of like different programs around the globe. I think that it's a very important point as well.
And just to give an example about what Angie is talking, like we had during the process, we're doing the interviews and then we are coding them, transcribing them and coding them. So we are getting like the information that's useful of every information and gather all together. Like every interview like could be 45 1 hour, and we have from 10 to 15 pages of information. So it's a lot of information that we have there. And that's why that's one of the aspects that qualitative research differentiates from quantitative. You have a small number, but each number you have so much information is unbelievable.
And I think if I could just jump in here as well, I think one of the points that is really valuable is about the comparison between like the Canadian context and even with the Ontario context of transplantation. I think one of the places that we're interested in looking at is the United States. So I think specifically with the United States, in some areas, to my knowledge, they've relatively been able to maintain transplant numbers. I'm not exactly sure if that is because of I guess I'm thinking like bed space and capacity, or whether it has to do with, I guess, how COVID is looked at or prioritized in the United States as a key factor, or like I guess some sort of like an infectious disease that they're really afraid of. So we're looking at, I guess, from the perception side of things, but I think also within the capacity side of things. So that's a valuable insight, I think, for us moving forward.
Gary, any final words?
Well, can I just, to the students, do you have a timeline? In other words, obviously you're students, so you want to complete your degree and graduate. So maybe you could explain to, since you've got a fairly large audience out here, what is your, in other words, in terms of completing the interviews, what is sort of, for lack of a better term, your end date? So, you know, because obviously you're not going to do this for, first of all, things will change and interest will change, but are you talking about the next 3 months, or what period of time do you want to complete all these interviews and discussions?
So in terms of our timeline, we will hope to complete the discussions in the next month. And the reason for this is we will need time to codify and transcribe all the interviews. And after that, we will have the time for analyze our data and produce the report and the article that we introduced before. So will be 1 month more for our conversation. And after that, we will start all the analysis of the data.
Okay.
So I just wanted to say thank you for a great presentation. Within the translational research program, we never know what our students do because the research is guided by them and directions. And I know that none of these students are particularly embedded in transplant. So I just wanted to ask, what got you interested in this? Why did you go this direction?
Sabrin, do you want to jump in?
Sure. I can jump in here. Sure. So that's actually a really, really good question. I would say it wasn't a definitive start. I would probably say that it kind of narrowed, it got here, I think, based on a need. But I think initially, the initial space that we were actually interested in, and this was based on just our personal interest and anecdotal, I guess, experiences with the space of organ donation. So initially we were really, really interested in organ donation, to see how that was changed, specifically with COVID. With us specifically, we obviously did not expect to come into our program and have a pandemic affect our thesis or capstone. So we thought it would actually be really valuable and probably very timely to investigate the space of, I guess, of like a pandemic impact. So that was one aspect. I think with the organ donation process as a whole, we started to recognize that it was a very limited space and a limited scope. And so we actually felt that it might have been more valuable to probably go within the transplantation space. And then after some consultation, of course, Dr. Levy was involved in that, being able to speak to transplant specialists and so forth, we started to realize that there was a problem potentially that existed within that space. And so that's eventually how we ended up coming into this space. And we're really fortunate that we've been able to work with the MOTP. It's been an invaluable experience, to say the least. So yeah, I'm not sure if any other of the team members wanted to add on, but that's my take on it.
Yeah, I think that we choose that because we since the beginning, we had the perception that organ transplantation essential survival. So we are aware of the importance of this topic. And of course, we have like MOTP, TGH, that's one of the world's greatest centers of transplantation in the world. So even that neither of us were like from the organ transplantation world or from UHN, this was something that we consider as well to decide on this topic and trying to make a difference, maybe bringing something that will be useful for patients and the healthcare system. I think this is all about what the translation research program is. So I think it fit well at that.
Thank you.
All right. So if there are no further questions, I would like to return the 13 minutes of your life back to you. And great job, guys. Very exciting project and has huge implications. Looking forward to participating in it. Thank you, Gary, for bringing this up to us and all these students. Great job. Thank you.
Thank you so much.
Thanks, everyone.